Thank you. So my name is Elizabeth Gedmark, Vice President for A Better Balance, and I'm trying to... So first of all, thank you, Chairman Crow, for holding this meeting and for allowing us to present you with this important information. A Better Balance, just by way of background for those of you not familiar with us, is a legal organization supporting women, caregivers, and children and families in the workplace. And we also wanted to thank the Tennessee Department of Health for this wealth of data and Tennessee-specific data. We wanted to thank ACOG for their letter of support this morning, and of course, want to thank our co-presenters from the March of Dimes. So we are here today to make the public health case for pregnancy accommodations in the workplace. So I will begin with a snapshot, just a demographic snapshot of pregnant women in Tennessee. Then Tamara will speak about preterm birth in Tennessee, and then I will conclude with information about the importance of workplace pregnancy accommodations. So just to begin with demographic data, and this is based on 2017, which is the most recent data that we have. There were 81,000 about births to Tennessee residents. 76% were to white women, and 20% were to black women, and the rest were to other races. And among Tennessee resident births in 2017, 72.6% of births were to mothers without a full college degree. And we'll talk about the importance of some of this data a little bit later in the presentation. So among about half of Tennessee residents who gave birth received TennCare coverage. That's in comparison to, for example, Missouri, where that was only 38%. So that number is 39,000 births that were covered by TennCare. And another 41% received WIC, which is the Supplemental Nutrition Program for Women, Infants, and Children, a federal program. In terms of workforce participation, among Tennessee's new mothers, over 2/3 worked at a job for pay during their most recent pregnancy. So this is the norm for women to be working during their pregnancies. It is no longer an outlier circumstance. And among those mothers, 2/3 returned or plan to return to their job after giving birth.
Well, good afternoon. Again, I'm Tamara Currin. I'm the Director of Maternal Child Health and Government Affairs with the March of Dimes here in Tennessee. And our mission at the March of Dimes is to fight for the health of all moms and babies. And we thank you for the opportunity to share. March of Dimes also believes that every baby deserves the best possible start. We thank the General Assembly for your work that aligns with that belief, and for passing legislation each year for the benefit of healthy moms and strong babies in Tennessee. As Elizabeth mentioned, we just wanted to share a little bit of data as it relates to premature birth in Tennessee. For a little bit of background, in 2003, the March of Dimes launched the Prematurity Campaign, which aims to reduce premature birth in the nation and individual states to no more than 8.1% of births annually. This gives every baby a chance at a healthy full-term birth of 40 weeks is the goal. Unfortunately, we know that it's not a reality for all babies, so there's still some work to be done. Each year in the U.S., there are about 380,000 preterm births. That's 1 in 10 babies born before 37 weeks of pregnancy. Nationally, after nearly a decade of declines, the past 4 years has shown us a steady increase in the preterm birth rate for babies, again, born less than 37 weeks of pregnancy. In Tennessee specifically, in 2008, there were nearly 9,000 preterm births, representing 11.1% of all births in our state. That's 1 of every 9 babies who's born preterm in Tennessee. This rate of 11.1% earns Tennessee a grade of D on the 2019 March of Dimes report card. Premature births may have more health problems, premature babies may have more health problems or need to stay in the hospital longer than babies born full term. Some of the babies also face long-term health effects, like problems that affect the brain, lungs, hearing, or vision. We also know that babies who are born preterm are also more likely to be low birth weight at less than 5.5 pounds. They're also at increased risk of infant mortality or death within the first year of life. Babies born preterm and at low birth weight represent the leading cause of infant death in the first month of life. To date, for our state, only 4 counties have actually met the National March of Dimes Prematurity Campaign goal of no more than 8.1% of babies being born preterm in those counties. Additionally, our report card reveals that racial and ethnic and geographic disparities exist, and babies have a higher chance of preterm birth based simply on their race and ethnicity or their zip code. So significant racial and ethnic disparities also persist in the rates of preterm birth, low birth weight, and infant mortality as well. So those trends continue across those outcomes. For example, preterm birth, as you see on this slide, among African American women is 45% higher than the rate among all other women, which is a disparity that is startling for us. We also see some differences in the impact of preterm birth in counties across the state, with county level grades in Tennessee ranging from grades of C to grades of F. Each county tells a different story about the risk factors in that area, which may include risks such as prior history of preterm birth, smoking risk, inadequate prenatal care, education level, poverty, job status, and stress. Lastly, the estimated average cost of preterm birth to society in Tennessee is $57,000 per preterm birth. This includes infant and maternal associated costs such as delivery, early intervention services that may be needed for preterm babies, and lost productivity in the workplace. The March of Dimes is deeply concerned about this impact and the birth outcomes that we've spoken of so far, and that impact on not only women and children, but also on families as a whole and our society as a whole. Encouraging healthy pregnancies is critical to reducing preterm birth and those associated outcomes. We know that medically the health of moms and babies is interconnected, and preterm birth impacts both moms and babies. Addressing these maternal health factors before, during, and after pregnancy increases the chances of a healthy full-term birth and a healthier baby. Again, we thank you for the work you have done so far and over all the years to help improve these outcomes in our state.
So, as you could tell from Tamara's presentation, many of these preterm births are entirely preventable, and we wanted to focus on one aspect of that today, which is the importance of workplace pregnancy accommodations. So what are workplace pregnancy accommodations and why are they so important? What they are is a modest modification or adjustment to a workplace, like a stool to sit on when someone is in the later stages of their pregnancy or is experiencing swelling in their feet. It might be a reprieve from heavy lifting. If a doctor advises a woman that now that she's pregnant, she shouldn't lift, say, over 70 pounds for her health and, of course, the health of her baby. So the Louisville Health Department, Louisville, Kentucky, in 2019 conducted a health impact assessment on this issue because there was a piece of legislation moving through their legislature, the Kentucky Pregnant Workers Act, that passed in 2019. And we wanted to present to you all some of their key findings and highlight for you why this is such an important public health issue and exactly how we might be able to prevent some of these preterm births, recognizing that it is such a huge problem. So some of the major findings of the HIA were that If you are accommodating pregnant workers upon their request, that can be critical for reducing these poor health outcomes, including things as serious and as irreparable as miscarriage, but also the things that Tamara spoke about in terms of low birth weight and preterm births, which are the leading cause of infant mortality across the country, as well as things like preterm births, unnecessary pain, risk of preeclampsia, a very serious condition. And I wanted to share just one story in terms of preterm births about a woman who worked in Charleston, South Carolina. And she was working in a shoe store there in Charleston. And they refused to allow her to carry a water bottle on the floor to stay hydrated, even though she was pregnant. And they knew that she was pregnant. One day, she didn't even get a lunch break, and she had to be rushed to the emergency room. And it turned out that she had preeclampsia, dangerous levels of high blood pressure, a very serious complication, and her baby arrived months early after an emergency cesarean section. And thankfully, that baby is healthy now, but he needed a great deal of treatment and care in the beginning of his life. And we would all in this room, I'm sure, want to prevent that type of thing from happening when we can. So the Louisville, again, Pregnant Workers Health Impact Assessment did find that the level of education that you have can limit the type of work that's available, which ultimately does impact health. So remember the slide before that 72% of Tennessee births are to mothers who don't have a full college degree. And that's important because they are more likely to be in physically demanding jobs, not office work where you can imagine it's much easier to get a potential accommodation, but instead might require something like a reprieve from heavy lifting. And this physically demanding work has been associated with an increased risk of preterm birth, low birth weight, and other complications as well. So the next few slides are pulling directly from that health impact assessment, showing what are the direct impacts, and I'll just go through a few of these examples of an accommodation that can be made, how it can provide a health determinant, and then the health outcome of that accommodation. So for example, if you granted an accommodation request of changing requirements to repetitively lift heavy objects, then that can reduce excessive stress to the body, and that can in turn lead to a reduced risk of preterm births and even miscarriages. Another example, increased access to water, the story that I told, and this could be in the form of carrying a water bottle or taking more frequent water breaks to visit something like a break room. That can lead to increased hydration, which might not seem as important, but in the context of pregnancy, it is critically important. That can mean maintenance of amniotic fluid, reduced preterm delivery, maintenance of blood pressure at an adequate level, and capacity to cool the body, as well as formulation of breast milk, which, as we know, has many health benefits for both moms and babies. And then finally, the ability to maintain employment and to stay on the job, because so many workers, when they are not afforded an accommodation, are pushed onto unpaid leave, are terminated, or feel forced to leave their job so as not to risk their health. Then they are able to maintain income and for housing and nutrition, and also it can reduce stress as well, which can lead to other detrimental health impacts, such as poor mental health, and as well as even cardiovascular disease. So in conclusion, the demographic data shows now that the vast majority of pregnant women and new mothers in Tennessee are in the workforce, and helping promote healthy pregnant women at work and their babies will mean a plethora of advantages. It will promote healthy mothers and babies, which will create savings for the state, where half of all births are on TennCare, and for employers by preventing costly health complications like preterm birth, which also costs a great deal for businesses, while allowing women to continue working and supporting their family, which will actually also reduce the burden on public assistance programs. Thank you so much.
Thank you. We appreciate your presentation.